Welcome in. Today's deep dive is all about getting you up to speed on childhood glaucoma. We're talking about a condition so rare, it affects just 1 in 10,000 infants in America. You're already ahead of the curve just by being here, wanting to learn more.
What's fascinating is that because it's relatively uncommon, families often find themselves navigating a medical landscape that feels pretty specialized.
Okay, let's unpack this. We're dealing with a condition that most people associate with adults, right?
Exactly. And while the fundamental issue is the same pressure building up inside the eye, the context of childhood changes the game entirely.
So it's not just about grandpa needing reading glasses. We're talking about potential vision loss at a time when those eyes are just beginning to make sense of the world.
And that's what makes early detection so crucial. But to understand that, we need to dig into the why behind that pressure buildup and how it manifests differently depending on the child's age.
All right, so walk us through it. What causes this pressure buildup in kids?
Well, imagine the eye like a sink, right? There's a constant flow of fluid, we call it aqueous humor, that needs to drain out to maintain a healthy pressure balance.
Makes sense. But in glaucoma, the drain gets clogged.
You got it.
Yeah.
In many cases of childhood glaucoma, especially at the type present at birth, called congenital glaucoma. The eye's drainage system just doesn't form correctly.
So it's like the plumbing was never quite right from the start.
Precisely. Now, there are other scenarios, often grouped under secondary glaucoma, where the cause is linked to something else. For instance, a condition called Axenfeld-Rieger syndrome can disrupt the eye's normal development, increasing the risk of glaucoma.
Wow. So we're talking about a whole range of possibilities, from developmental quirks to other medical conditions that can trigger this pressure problem. That's a lot for parents to be aware of. So many different potential causes. It makes you wonder, how in the world do you even know if a baby or a young child has glaucoma? They can't exactly tell you what's wrong.
You've hit on one of the biggest challenges. In infants, those signs can be subtle. Doctors and parents are looking for clues like a cloudy cornea, that's the clear front part of the eye.
Like a frosted window, sort of.
Exactly. Or there might be excessive tearing, even when the baby isn't upset.
But
And in some cases, the most noticeable sign is an enlarged, bulging eye.
that's heartbreaking, especially because you know something's not right. But those little ones can't tell us what they're experiencing. What about older kids? Do the signs become more obvious?
Here's where it gets tricky. Sometimes symptoms in older children can be surprisingly silent. A child might not complain about vision problems until the damage is already done.
So we're in a race against time to catch it early. That's why those regular eye exams are so crucial, even if there are no obvious red flags. But let's say glaucoma is suspected. How is it actually diagnosed in a child?
Diagnosis typically involves a few key steps. One is tonometry. It sounds intimidating,
Right.
but it's just a way to measure the pressure inside the eye.
Like taking your eye's blood pressure, in a way?
That's a great way to put it. Then the ophthalmologist will want to get a good look at the optic nerve, which connects the eye to the brain.
Because that's the nerve that can be damaged by the pressure, right?
Exactly. They'll use special instruments to check for any signs of damage. And of course, understanding the child's medical history, especially any family history of glaucoma, plays a big role.
Okay, so let's say a child is diagnosed with glaucoma. What happens next? What are the treatment options? And what can be done to protect their vision?
This is where things can start to feel hopeful for many kids, especially those with congenital glaucoma. Surgery is often the first line of treatment, and the goal is to create a way for that fluid to drain properly and relieve the pressure on the optic nerve.
Surgery on such tiny eyes sounds incredibly delicate. What does that even look like?
You're right. These are incredibly precise procedures. One common approach is called a trabeculectomy. It involves creating a tiny drainage hole to allow the fluid to escape.
So, literally creating a new pathway for the fluid to flow out.
Precisely. Another option is implanting a shunt, which is like a tiny tube that directs excess fluid away from the eye.
It's amazing how advanced these procedures have become. But what about medications? Are those part of the picture too?
Absolutely. Eye drops that help lower eye pressure are often prescribed, either before or after surgery, and sometimes is the primary treatment to manage the condition long term.
So we've talked about these incredible surgical advancements and the role of medications, but with treatment, is childhood glaucoma something that can be cured, or is it more about managing it over a lifetime?
That's a really important question. While treatment can be incredibly effective at preserving vision, childhood glaucoma is often a lifelong condition. That means early detection and ongoing management are key to preventing further damage and giving these kids the best possible visual future.
That makes those early eye exams even more critical. It's about so much more than just getting a prescription for glasses.
Exactly. It's about catching potential problems before they have a chance to steal sight. And it's about empowering parents to be proactive advocates for their children's eye health.
We've covered a lot of ground here. It's clear that early detection is paramount. But what are some of those key takeaways parents and caregivers should remember?
It boils down to this. Those well-child visits, even in infancy, are not just about checking height and weight. It's about making sure those eyes are developing properly, that the plumbing is working as it should.
And if there's any family history of glaucoma, that's even more crucial to bring up with your child's doctor.
Absolutely. It helps paint a fuller picture of their risk factors and guides the doctor in knowing what to watch for.
We've talked about the medical side of things, but I imagine a diagnosis of childhood glaucoma also has a huge emotional impact on families.
It absolutely does. Suddenly, parents are faced with a diagnosis they may not have even heard of, and they're tasked with making important decisions about their child's care.
It's a lot to process, both medically and emotionally.
It is. But here's the good news. While childhood glaucoma is a serious condition, it's not a hopeless one. With early detection, appropriate treatment, and ongoing management, children with glaucoma can absolutely go on to live full and vibrant lives. With your vision intact.
That's a powerful message of hope. And for our listener who wanted a deeper understanding of childhood glaucoma, I think we've delivered.
I agree. Knowledge is empowering. And in this case, it could make a world of difference in a child's life.
Couldn't have said it better myself. And for anyone listening who feels like this conversation has raised some questions or concerns, don't hesitate to reach out to your child's eye doctor. It's always better to err on the side of caution when it comes to something as precious as their sight.
Absolutely. Early detection and intervention are key.
And on that note, we'll wrap up this deep dive into childhood glaucoma. We hope you found it insightful and empowering. Until next time, keep those minds curious and those conversations going.